Hi everyone, welcome back after what is an excellent film produced by Groundswell, and a huge thank you to Groundswell for allowing us to show that as part of our conference today. I'm sure that lots of the themes within that really resonated with many of you, particularly those of you who are delivering frontline services, both within accommodation and particularly in outreach as well. I think we were really keen to show the film because we spent a lot of our conferences talking about strategy and high-level policy, about upcoming budgets and action plans, and I think it's really important that we remember the people that we're here to support, the people at the centre of the action plans and the strategies. And I think that the stories that Groundswell were able to collect and then kind of showcase within the film are a really important reminder of why we're all here, really, and why we're trying to do what we do on a day-to-day basis, and why we're so passionate about the ambition of ending homelessness in Wales. I'm really delighted to be joined by Anthony Vaughan, who heads up the PI work and therapeutic work for the Wallich. Thank you, Anthony, for being here today. First of all, just wanted to kind of hear your reflections really on the film and your thoughts about the themes it raised.
Thanks for inviting me today. I'm very pleased to be here. I guess my initial obvious reflection is, like you highlighted, even though it is a fictional character, Clarissa is somebody that I, well recognise from my time as a frontline worker and a manager of frontline services. She reminded me especially of somebody I used to work with off and on for years back in Aberystwyth. So it's not somebody, I'm sure, and I'm sure it's the same for colleagues across the symposium, that recognise a Clarissa or somebody very similar to her and the issues that she faces, really. The trauma that she's experienced and how that sort of impacts on her in her current life and trying to access health services is definitely something that I'm sure we all recognise.
Thanks very much, Anthony. So we've got a few questions already, but I'd like to invite people to put questions in the Q&A, and also, as a couple of people have done already, to just share your thoughts in the chat bar. Thank you to Hayley and to Kathy for sharing your views on the film. It's really nice to hear that feedback, and we'll share that with Groundswell after the conference today. So, Anthony, I guess the theme at the centre of this was one of trauma, really, and the impact of people. And how much did you recognise in terms of that impact of trauma on Clarissa that kind of correlates with your experiences of supporting people and the barriers that they face in terms of trust and so on?
Yeah, I mean, it's a key part of, it's a main part of our work, isn't it? I mean, I guess we know that the people that we work with aren't people who've got something wrong with them. They're people who've had something happen to them, and they're survivors of trauma. And unfortunately for them, that trauma casts a really long shadow over the rest of their lives. So, and the way they respond to that and the way they cope with those things, those are the things that make it very difficult for them to navigate something like the healthcare system, or even settling in a residential project for the first time, or accessing any kind of support. Really, it's it's at the core of the work that we do, really. In my experience, I've seen service users really struggle to access healthcare services, mental health services. Not often, but usually you'll find that when it's working, particularly GP services, say, for example, there is somebody there or a couple of staff there who know them or who have got to know them and can navigate them coming into the system. So, and then if a new person comes in or different staff are on, even though if they've been going successfully to a GP surgery, that's when it will often break down, when somebody different is there who deals with them in a different way, in a less trauma-informed way, I suppose. And that's not necessarily saying those GPs have had trauma-informed training. Maybe they have, maybe they haven't. But it's the importance of somebody having an understanding of that person going there, like the homelessness nurse in the video. That's the key thing, isn't it? Is somebody knowing that person and having a trusting relationship with them to be able to get them the help they need, I suppose.
Yeah, and Ellie in the chat has commented on something that really struck me when I was watching the film about the persistence of that one health worker who, you know, got told to go away on several occasions, you know, was questioned about what her agenda was in reaching out to Clarissa. And that must have been really disheartening for the healthcare worker to be confronted by those reactions when she's trying to be helpful. But, you know, she didn't let that dissuade her. She went back time and time again. It was about that persistent offer, and also trying to, I guess, meet Clarissa where she was comfortable, understand some of the things that might interest Clarissa, the trainers, or, you know, and use those things to build the relationship. And I guess that's something that with your support workers at the Wallich, you know, that in your outreach teams and also within your other support worker teams, that persistence, even when people don't necessarily want to engage today, going back and making that offer, and making the offer in lots of different ways as well.
Yeah, it's that persistence and consistency as well, isn't it? Like, you know, she said, I'll be there tomorrow, and she said, well, it's my day off, but I'll go. And at that time, and being, you know, doing as you promised as well, isn't it? Being consistent and doing as you promised. And I think that comes from obviously our staff, but having an understanding of where, you know, those behaviors are coming from. You know, a lot of the people we work with get termed as having challenging behavior, don't they? But I was on some training a while back and learned that turning it from challenging behaviors is a behavior that challenges us, because that, you know, challenging behavior implies that it's inherent within the person and it's, you know, it's their fault sort of thing. But usually the behavior arises from an interaction with a system or with a person or whatever, isn't it? And for that person, even though the results may be challenging, the behavior at the time is exactly what they need, because it keeps them safe. It keeps them, you know, that's how they cope sort of thing. So it's trying to keep that in mind, isn't it? I know it's very difficult when you're faced with behavior like that and it's directed at you, though usually it's not about you, is it? Even if it's directed about you, it's difficult in the moment to keep that, depersonalize that, I guess, sort of thing. But if you've got that understanding, you know, you can sort of go back and reflect on it, can't you? And you can sort of understand where it's coming from, maybe even identify some triggers that caused it, so, you know. And as you say, it's that trust in relationship, treating somebody like who let's be honest, society might consider dangerous or a high risk or whatever, isn't it? But treating that person like a human being and talking to them like you would anybody else. I think, you know, for me, that is the work, isn't it? That's the core of the work, is treating people like you treat anybody else, having a human relationship with them.
Definitely. And you could see in the film something that, you know, we see all too commonly on the streets is members of the public averting their eyes. And, you know, that's often comes from a place of not knowing how to respond to people who are on the streets or asking for money. And I think one of the things that we always try and say is, you know, that kind of thing about the person being a human being and treating people as a human being. And, you know, maybe you do have some coins to give the person, maybe you don't, but saying hello and having a chat if you have a spare couple of minutes. And, you know, because too often people on the streets are kind of blanked, and that can be really dehumanizing. You touched, Anthony, on, you know, the really challenging situation that support workers can find themselves in when they're, you know, being told to go away. And it's the resilience is really difficult to keep up, and I guess that shines a light on the importance of support for staff, doesn't it? And something that we've been talking about increasingly over the past few years is that psychologically informed approaches is not just about the relationship with the person using the service, it's also about supporting staff. You know, so can you talk a bit about how important you think is for reflective practice and clinical support for staff where they need it?
I think it's crucial. I mean, we're trying to embed reflective practice across all the organisation at the minute. I have a high operations facilitator who works underneath me trying to do that. But I got to say, when you launched your manifesto in, I can't remember when it was, in the summer, was it? And one of your asks in there was, if you are commissioning a service to be psychologically informed, then it can't just be for support hours, can it? You need to put your hand in your pocket for the additional stuff that comes around that, whether that's reflective practice, clinical supervision, depending on, you know, what you need, what the service is, and what staff will need. I think is crucial. You know, most staff in this sector are already pretty reflective, aren't they? But they're internally reflective, and, you know, they'll be thinking about stuff and going over it. But the true sort of learning and development comes from reflecting together and doing that in an open and honest way. And there is a skill in that. It's not something that, and sometimes managers can do it with their teams, but often you might not want a manager doing it. It might be somebody independent of, ideally, because you want them to be a true safe space, don't you? So I think that's the crucial part, isn't it? Most organizations have got good reflection and good peer support with their colleagues and with their manager, but if we're thinking about true resiliency, working in a trauma, particularly in some of the key frontline projects where we're working with the most people with the most complex or compound trauma, then I think we do need we definitely need that additional bit more support in reflective practice or clinical supervision, certainly. Yeah.
And that's certainly some of the things that I've been trying to highlight during this pandemic, particularly when we've been trying to get frontline workers within the homelessness and housing support sector recognised for a variety of, the statutory sick pay enhancement scheme, the bonus scheme, the profile as key workers and the access to childcare and PPE, and the priority within the vaccine priority list. Like, none of those things were a given at the start of this pandemic, and it has been organisations like ours, and also credit to the Welsh Government housing officials who've been saying to the health and social care elements of Welsh Government that you may not be familiar with these workers because most of us are lucky enough to never need a homelessness service. But this is what these workers are doing. They're still going out there on a day-to-day basis. And, some of the environments that they're working in due to the complexity of trauma means that it is very challenging. And they need protection and they need support. And, I couldn't agree more, Anthony, on the need for, commissioning to reflect that. And that's something that we've been pushing for a long time, and certainly something that we're continue to push in the workforce task and finish group that is taking forward some of the homelessness action group recommendations. I've been really clear that, yes, we need to look at pay. Yes, we need to look at terms and conditions of recognition, but support, reflective practice and clinical supervision absolutely needs to be included in that, and that costs money because that means that you have to go beyond paying staff the hours of support that they deliver. You also have to pay them for the hours of reflective practice that they're taking part in, as well as as you really well put, the need sometimes for independent psychological support as well.
I mean, we as a sector, we're not regarded as a professional body, are we? We're not. Sometimes I don't believe we get the respect that we deserve for the work that we do. And going back to my job title, psychologically informed environments, PI operations manager. So I've built a relationship over the last 18 months with Robin Johnson, who's the guy that coined the term PI, and he has explicitly told me, when he coined the term back in 2010, he was a communities psychiatric social worker, and he coined it because he couldn't believe what he was seeing in homelessness services and how the staff in homelessness services had a relationship with people that he as the statutory service could only dream of. And that's where everybody's going on about you must work in a psychologically informed way. That's where it comes from. It comes from the homeless sector. He created the term to give a name to what he was already seeing us doing. So I think we don't get enough credit for the work that we do and the relationships we have with people who, I'd be surprised if many statutory services have as good relationships with the people that we work with as we do.
And that again is linked to trauma, isn't it? And the case of Clarissa, clearly there were things going on in her childhood that weren't picked up or responded to appropriately by social services, for example. And we know a lot of people in the homelessness system have been failed by other statutory services in their past, and that has a real impact on their ability to trust anything that they see as an arm of the state. And I think that's where particularly charities have a real strength in the viewed as being independent from the state and able to build that trusting relationship. I'm just going to pick out, we've had some really great comments, and I just wanted to pick out some of the points that people had been made. So as I said, Ellie said, very powerful, showing how one key relationship and the persistence of that support worker is what makes a difference, particularly that personal relationship focused approach. there's Lynn has made a great point. It's not about clients engaging with services, it's about services engaging with clients, and that's a really good way of looking at things, and kind of in line a bit with, you know, not what's wrong with you, but what has happened to you. There's some really kind of subtle changes in how we talk about things that can make a big impact on perceptions. Really excellent, and shows how the difference the persistence of a frontline worker can make. Shows the importance of flexibility of access for services, and how the simple act of going to a GP is not accessible for many, and how this might be addressed. Anthony, you know, you've kind of worked with people trying to access healthcare services throughout your career, and I guess you know, what are your reflections really on some of the barriers that they face when they've been trying to access, whether it's GP level or maybe mental health services or others?
Well, I mean, it's, you know, you can't go with somebody all the time. I guess beyond, you know, if the best way to do it would be for somebody supportive, your support worker, to go to appointments with you, isn't it? But we just don't have the resources to do that all the time. So I think it's that's a major barrier. And then, you know, for people going there, if there is any, I don't know, disruption, or somebody's a bit short with them, or, you know, particularly often GP stuff can be around when people aren't feeling great anyway, perhaps they're in withdrawal, you know, and those sort of things. And it just flares up, doesn't it, into an angry outburst or avoidance and running away, really. And, you know, particularly for some services, like if you're trying to access mental health services and you don't make that appointment, you've got a couple of appointments, you've missed those and you struck off, and, you know, you've got to start the process again, isn't it? So, I mean, those tend to be the barriers. It's the lack of understanding, I suppose, of the person in front of them, and then trying to navigate a system which is difficult at the best of times, isn't it? Without but having said that, I can think of many appointments I've been to with service users over the years that still went horrifically because of, you know, it can sometimes be some judgments, can't there, on the people that we're working with and the reason that they're there, sort of thing, you know. And so I think it's sort of a wider understanding of trauma-informed approaches, as I think is probably needed for everybody, really, isn't it? To understand that, you know, and people that are coming to you, particularly from sectors like us, there may be issues that you need to address or need to think about when you're dealing with them, really. I mean, and no disrespect to GPs or mental health services, they are very stretched. They've got, you know, it is a very busy service. There was I was on one of the UK PI forums a few weeks back about PIs and neurodiversity, and somebody mentioned on there something called like a diversity passport, or somebody else had mentioned something called the FAME, the Facts About Me document, which is kind of like the things you need to know about me, and, you know, and the best way to work with me and all that sort of stuff. And I think our sector is ripe for something like that, isn't it? Is if we could agree on something like that we could send as a sector before that person goes there, this is what you need to know about me and this is how to engage with me, then I think that would be, you know, some way towards tackling this, wouldn't it? Now, given you still need services to trust what's in there, is what they need to know to work with that person without bringing up the form and going through all this stuff again, you know. But I think something like that is a way around this, really.
Yeah, and it touches on the next question that I was going to ask. You know, obviously in the homelessness sector, over the past sort of 3 or 4 years, we've tried to increase the focus on psychologically informed approaches and trauma-informed approaches. And while we're certainly not there yet, I think we've made significant progress in terms of how we talk about this, the culture, and increasingly how it kind of forms part of the service provision. But the people that we support in our sector interact with loads of other public services. And unfortunately, not all other public services have got this as high up on their agenda. You know, what would you like to see happen in terms of other public services becoming more trauma informed? And, you know, is it something that you'd like to see the Welsh Government, you know, show leadership on and try and encourage that across all public services?
I think it has to be, really, doesn't it? If this, it should be led from the top down with Welsh Government. And, you know, that's not to say that it isn't already happening. I see trauma-informed approaches or trauma-informed care coming through in a lot of things, you know, the education and criminal justice stuff in particular. It's going out there wide. But, you know, if we want the sector, or, you know, not the sector, the sort of the space that our clients interact in, which is, you know, all sectors, isn't it? That I think it needs to come from Welsh Government to say, this is an approach that we want you to adopt within your policies and procedures, and, you know, whether how you do that exactly, or you've got some kind of, you know, trauma-informed impact statement that you put policies through and say, does this affect somebody's safety? Is it a collaborative project? That sort of thing. I'm not 100% on how we do that as yet, but I think it's got to come from the top, really. And it's not like, you know, I sort of rolled trauma-informed care out this year for us as an organisation as the framework to underpin our 75 plus psychologically informed environments. And I did that with a sort of 90-minute, 2-hour online trauma-informed care course, which is excellent, and it gives you what you need, really. And it doesn't have to be super in-depth, does it? It's just, this is what trauma is, this is how it affects people in their responses through that. You know, recovery from trauma comes from healthy relationships, and these are the principles that you need. You know, it doesn't need to be rocket science. It can be quite, and once you've gone through that, as long as you keep those things in mind, I think that's the start, isn't it?
Definitely. Some more comments that are coming through. It's the persistence and consistency that really came through for me. So many people with complex needs have been let down time after time by family, friends, services. So they need to really trust someone before they can open up, and the film really demonstrated that so well. Excellent film, non-judgmental, trauma-informed approach is essential to build trust, a great resource for all frontline worker training. Kirsty said, absolutely agree. Clinical supervision and reflective safe space has been key to supporting our youth work staff team who are working with such complex trauma. And it's great to see so many comments coming in on the chat that are really supportive of those themes. One of the things that we saw in the film, Anthony, was the importance of outreach. And I think one of the comments reflected on that flexibility around going to people where they are, making services or access to professionals accessible in lots of different ways. And I guess while we would like the NHS to be more accessible and easy to navigate, I think there's lots that we can do within the sector, collaborating with health professionals as part of outreach. And I know, you know, at the Wallich, you have a number of outreach teams that go out and work with people on the streets. And I guess that's a really key part of starting to build those relationships for people who are maybe the most marginalised.
Yeah, I mean, again, it's just going out there and meeting people where they're at, isn't it? Whether that is on the streets or when somebody first comes into a project, meeting them, you know, doing what's needed for them at the time, really. So like you say, it's the consistency, it's been able to help them in whatever way they can. And you do find, you know, in a lot of areas that the outreach teams in particular will have good relationships with a nurse. I know there's a really good, strong homelessness nurse in around the Swansea area, and back where I used to work in Aberystwyth, there was a BVV nurse that used to do a lot with it, you know, so you will find that they are out there. It's just shoring all that up across the board, really, isn't it? So yeah, I mean, and that the breakfast run and the assertive outreach and the solutions teams we've got, they're key to that first port of call, really, getting out there and meeting people. And
I think we've seen during the pandemic a sort of increase in partnership working, when the Welsh Government was so clear that everyone needed to be brought in and that we needed to do whatever was possible. Actually, you know, some of those relationships were really strengthened, particularly with substance use services and mental health. What we don't want to do is revert back to how things might have been pre-pandemic. How important do you think it is to maintain those kind of multi-agency partnerships as we move forward?
Yeah, well, it's key, isn't it? That's, you know, as I said about this, whether it's diversity passport or whatever, you know, we need to be all working in a similar way, don't we? Singing from the same hymn sheet to support these people. So yeah, all the good work that has happened in the pandemic needs to stay, doesn't it? And I think it's crucial that we keep it all going. It's got to be done, really. Yeah.
And for me, you know, I think there are not many silver linings from a pandemic, but the fact that we know much more about people who were maybe hidden homeless before. Obviously, huge numbers are in emergency accommodation at the moment, which isn't great. However, there is some really positive engagement with support services in a way that, you know, people have not been able to do for many years. And so from my perspective, we have a huge opportunity if we continue to be trauma informed in the way that we work with people, to make really significant impact on their lives from this moment onwards.
Yeah, agreed. It's just picking up where carrying on with what we've already done, and as you say, there's a lot of people in emergency accom who wouldn't necessarily have been in there before. So it just goes to show the need for what we do, doesn't it? And to keep following in those approaches. And we know that there are people back out on the streets now. It happened through the pandemic. There were few people on the streets, but it's back. Getting up to some high levels in some local authorities, isn't it? Back. So it's trying to get those people to work in the same way as we did during the pandemic, really. And not that the pandemic's gone anywhere, and we may well be having to do it again soon. But what's said about that, the better.
And I think we often talk about. I know the ACE Support Hub, for example, is really passionate about looking at psychologically informed approaches in a very preventative lens. So looking at young people and children, and often people perceive the sort of approaches that we have in the homelessness sector as kind of being almost too late. Those people have experienced that crisis, and we're trying to help them to recover from that. But actually it's also preventative in terms of stopping the cycle for the next generation, isn't it? And it's really important that we're being trauma informed to some of the people we're supporting, so that that cycle doesn't repeat itself to their children. Yes,
exactly. And to give the example that people can recover from this stuff, isn't it? From this stuff, from trauma. And if you are working with people who have children, then that's the preventative measure is getting it out there. And even though these people have experienced trauma, it's trying to show them there's a different way to be, really, and that there is a way out of it.
Definitely. I've seen a couple of comments in the chat asking about whether the film can be shown to the regional housing support collaborative groups. Need to make sure I get the acronym right there. Saying it's really powerful. It'd be really great to show it at the RCGs. I think we'd be really supportive of that. Groundswell would be delighted. They're really keen. They made this film to inform people, to educate people, to improve responses. So I know they'd be absolutely delighted for the film to be shown at the RCGs. And I think it would be great, particularly given the kind of multi-agency nature of some of those RCGs, for this to be shown to people who are maybe not always on the front line of homelessness and witnessing these sorts of issues on a day-to-day basis. So we will get in touch with Groundswell and share that with them. As I said, I think they'd be absolutely delighted, and we'll get in touch with the RCG reps and RDCs to provide the link to the film and some more information there. That'd be, I think, a really great action to take this forward.
Yeah. It's a good example in the film as well, isn't it? Of if you look at who made it, or the lived experience aspect, and the PS, of talking to people about what's happened and getting their views, and that's something like that. It's only come from talking to real people about what's happened with them, isn't it? So.
Definitely, and that's something that Groundswell were really, really passionate about emphasising, was that, although the film featured one person, Clarissa, it was a combination of all of the different kind of stories and experiences that were told to them. And, I think Suzanne made the point in one of the earlier sessions that it's important that we don't make assumptions about what people want and what people think, and that we're continuing to engage with people with lived experience to really listen to them, to what happened to them and what would make a difference to them. And it's something that you're passionate about at the Wallich as well, isn't it, Anthony?
Yeah, absolutely. It's, we've got a shadow board of current service users, and, we're trying to embed, consultation, those trauma-informed care principles, in fact, collaboration, trust, empowerment, trying to get their views throughout. It's not something that's always easy to do, particularly when you want the view of the person that's just walked through the door, when often the view of the person that you get is perhaps people sort of further along in their recovery journey, whatever you want to term it. But it is something we're very passionate about doing, and ensuring that we embed throughout everything that we do.
Definitely. And at Cymorth, we've been working to establish a Experts by Experience project that will be launching in the new year. So it would be great if people in this conference session could keep their eyes out. We're going to be providing a number of varied and different opportunities for people with lived experience to continue to input into Welsh policy, into practice, in a similar way to how they influence the Homelessness Action Group recommendations. And we're also looking to provide a number of kind of learning and development and confidence building opportunities for people with lived experience. So keep your eyes on your email boxes and look out, because we'd love to see lots of people from across services being involved in this and helping us to hold the Welsh Government to account.
I recently, I was just going to very quickly jump in and say I recently heard about and met somebody from what they called an organisation in Bristol who really values the input of services of consultation and pays them, a decent wage for each piece of consultation that they do. And it was interesting to me to sort of think about it in those terms, because often it's done on a voluntary basis, isn't it? Or you get a voucher and all that sort of stuff. But it was an interesting, eye-opening conversation that I had. So yeah. Absolutely, and it's something that Freya, who's our Experts by Experience officer, who's recently been appointed to coordinate the project, and Alex, who you'll know as our Housing First coordinator, we've been talking a lot about that recognition, and it's sometimes a very difficult balance in terms of you don't want to mess up people's benefits, which is always the huge risk, but making sure that people are recognised and rewarded for what is their expert input, and we should be treating it as such. So we're busy working on that, so keep your eyes peeled for that. Anthony, I want to say a huge thank you for joining us today. We've had a fantastic conversation. I've really appreciated your insights and reflections on the film and on the work that you do at the Wallich. So thank you so much for being here today. Thank you to the audience. There were so many brilliant comments in the chat. Thank you for sharing your reflections. We're going to share those with Groundswell, who will be delighted that so many people have found the film useful and have engaged with it. We're going to close this session very shortly, but we have two excellent sessions coming up later this afternoon. At 1:45, we'll be hearing from the Centre for Homelessness Impact. They'll be sharing with us work that they've been doing with individual local authorities across Great Britain to reduce homelessness. So we're really looking forward to hearing from them, and hopefully that will be useful for those of you who are busy working on housing support strategies in local authorities in Wales. And then we're delighted to be hearing from the Institute of Global Homelessness, from Lydia Stadson, who is the director based in Chicago. She'll be joining us very early their time to finish the conference and share with us the work that they've been doing across the world to reduce homelessness. Thank you so much for coming along, for sharing your thoughts and reflections, and we hope to see lots of you in 15 minutes time. Diolch yn fawr iawn.